apart from you, Sue, and you, Jonathan, when you start, and other speakers. So thank you, everybody, for joining us today. First community conversation of 2022. I better get that right. Yeah, really good to see you all. I'll introduce Sue. No, but she doesn't need introducing, but you don't, Sue, honestly. Go ahead.
No, hi, I'm Sue Lukes. I'm a councillor for Highbury East, very proudly the councillor for Highbury East Ward, and also I'm the executive member with responsibility for community safety and pandemic response, and I think it's the last bit of it that is the reason I'm here. So it's lovely to see you all. Apologies for being a bit late. I was faffing around with the tech as usual. I'm sure there are more doing that, lined up behind all of you as well. Yes, are we going to go around and get everybody else to introduce, or shall we ask people to introduce in the chat?
I would say introduce in the chat, if that
quicker and easier, and also then we can all save the chat and see who else we met with. So that's
absolutely okay. Go on, Sue. Sorry.
Right. I wanted to welcome you all. I mean, we've had quite a few of these conversations. I think this one has a different emphasis, doesn't it? Because although in the past what we've done is really had sort of open house, so that borough residents, people working in community, voluntary and faith sectors, and anybody else really who was concerned about what was going on could come along and be and sort of ask questions, get information, get vital information, and if you like, feel that they were part of the tremendous effort the borough put into getting us all through a bloody difficult couple of years. So this one has got a different emphasis because, as I hope some of you know, I'm not entirely sure what everybody's had in terms of written information, but it is to think about what the community, voluntary and faith sectors can do at this point in time, if you like, because we're at a kind of crucial point where we still need more people vaccinated in the borough. We are down on numbers in terms of the numbers of people we would like to see getting that vital protection of vaccination, and we also need to think about how it is we're going to keep people safe going on into the future at a time when, speaking frankly, the government has given up on that. But we are very much aware that although rates of infection are very slowly going down in London, including Islington, it's still a very infectious pandemic, and there are still lots of people who, because of their vulnerabilities, if they were to catch it, would suffer terribly and be very much at risk. So we need to think about how it is that we want to carry on looking after everybody in our community and making sure really that people are able to live their lives, because I think, it's been very, very hard especially for vulnerable people who have felt that, they couldn't necessarily venture out of their doors without feeling unsafe. So I think what I probably want to do is hand over to Jonathan, who will give us an update, as we usually do. Jonathan has been one of the heroes of the last couple of years on where we are and what we need to worry about and answer questions. Is that what's... Sorry, Navindra, I'm having trouble with my tech at the moment.
Oh, it's absolutely fine. That's exactly how we're going. So Pam, could you put Jonathan's slides up, please?
Yeah, which am I doing first?
So
the vaccine one or the update, Jonathan?
Could you do the update first, please, Pam?
Sure.
Thank you. Okay, so whilst Pam's doing the honours with the technology, I'll introduce myself. For those of you I haven't met before, though, it's lovely to see so many of you from our previous community conversations. So my name's Jonathan O'Sullivan. I'm Director of Public Health for Islington. I work very closely with Sue, and I've also got some really terrific colleagues here, Navinda from VAI, lots of other people from our community, voluntary and faith and migrant health sectors, and also colleagues from public health, community engagement and communication. So really good opportunity to sort of talk and take stock about what's happening currently around COVID-19 in the borough. So I think the last time we had one of these conversations, we were in quite a daunting position, really, because Omicron, which perhaps, like if you're like me, first new word for the vocabulary, very rapidly taking root at the start of December, spreading very, very rapidly indeed in Islington, across London, and indeed across the entire country, and in fact now across the world. And at that point, every possible bad thing you could possibly think about COVID was coming through. So far more transmissible, some estimates suggesting it was around 3 to 4 times more transmissible than Delta, which was the variant before. Remember, Delta was more than double as infectious as the original variant, which arrived at the start of 2020 here in London. Much shorter incubation time, so probably around 3 to 4 days, doubling in London at one point every day, or certainly every couple of days, and really dramatically able to overcome a lot of immunity in terms of catching the infection. So if you'd had 2 vaccinations, you perhaps had 20% protection against catching the infection, maybe no protection. If you'd had previous infection, which does give some immune protection, again just rolling right over all of that. And that's because there were some major mutations in the Omicron variant. So in particular, that nasty spike protein, the thing which invades human cells and sort of gets the infection going, mutated in a really big way, in a way that existing antibody responses would struggle to respond to. And other sort of mutations made it actually, once those antibodies did get onto the virus, making it more difficult for them to stick on. And against all of that, we were looking at very, very high levels of infection. And even if it wasn't necessarily as virulent in terms of impact on health as say Delta had been, because we were looking at so many infections potentially coming through, a real prospect that the NHS social care would be overwhelmed, and that we again be looking at many people needless, very ill, potentially at risk of dying, certainly at risk of hospitalisation. What has happened since then is that we are seeing, for I think 3 key reasons, that we have got a position where we are able to manage with COVID infections running at a high level at the current time. Now, an important component of that is vaccination. So even though having a first or second vaccination would not necessarily protect you from catching the infection, what it did was it gave the body enough immunity to be able to fight off the infection, so it didn't really take hold in the way that previous variants could. So even a first vaccination, even though it probably doesn't offer much protection against catching the infection, more than halves the risk of being hospitalised or becoming seriously ill compared to someone not vaccinated. 2 vaccines, that goes up to around 60 to 70%, and boosters up to around 88%. And I think last week some data came out suggesting it was actually a smidgen higher than that at about 90%. And what was particularly important, particularly with the booster vaccinations, was that our older and more clinically vulnerable communities were being really, really protected by that booster. So you've got an immediate, very big antibody response, which does help to reduce the risk of catching COVID and indeed passing on COVID, but also importantly dramatically reduces the chances of becoming seriously ill. So the first factor we had on our side were the vaccines, and I want to thank all of you for everything that you've done to promote the vaccines in that huge run up to Christmas and the New Year. Indispensable support from our volunteers, from people working with the NHS, from our own staff, through communications engagement, helping people to get to vaccination centres. And I think it's also been tremendously helpful that we've had so many more locations in the borough at which people have been able to get their vaccinations. The second element which has really protected us was this virus. So viruses, sadly, when they mutate and vary over time, do not always become less virulent, or certainly in this case, it's become much more infectious. And in fact, they can become more deadly over time. What we've discovered with Omicron is that part of the reason why it is so transmissible is also part of the reason why it's been less likely to lead to hospitalization. And that's largely because the virus, unlike the previous variants, which went deeply into the lungs, is actually much more present in your airways. So that's partly in your throat. So sore throats have actually been really common as a symptom with Omicron in a way that it wasn't with some of the other variants. But also there's other tubes that link into your lungs as part of your airways, your bronchi, which the virus is really keen to. So on the one hand, because it was much higher up in your airways, hence more virus, more transmission, but not so much in your lungs. Now, COVID actually makes people ill in a whole series of different ways, as we know, but the first and most serious presentations are in the lungs. So the fact that it was more in the airways and the lungs has also proven to be very protective against hospitalization. That, I have to say, is simply a quirk of this variant. If we would see another variant, it doesn't mean that that would necessarily continue. So that we continue to think and remain vigilant into the future about what might also happen. And then the third really important thing, I think, which happened, I think it really exemplified in Islington, was about the things that we did to keep each other safe and ourselves safe. So there's a huge increase in people wearing face coverings again indoors. A lot of people had never stopped wearing face covering indoors, but it was really noticeable, that difference. We had premises, whether they were shops or hospitality or nightclubs, etc., which were following good practice rules way before Plan B guidance was coming out about doing extra checks and ways to stay safe. And people reduced mixing, partly following the guidance about work from home if you can, think carefully about when you meet people indoors, meet outdoors if you can. I know it's cold, but people do it. So all of that collective endeavour about looking after other people and also looking after yourselves had a huge impact. So vaccinations, and also, to be clear, some immunity from previous infections, a change in how the virus takes root in the body, and the things that we did to keep each other safe by following other safety measures over and above the vaccines, all of that came together to make a huge difference. So as you can see on this graph, we still saw an absolutely huge increase in infections in the borough, and indeed across the whole of London, across the whole of the country. And this is now being replicated in so many countries internationally. Even New Zealand, which, as you probably know, had almost no COVID cases, has now got Omicron has sort of landed in New Zealand. So, you know, one has to just really cross fingers. Highly vaccinated community, which is very good, but no previous exposure or very little previous exposure to COVID. So, you know, let's cross fingers there, because it is still very capable of being a really nasty infection. So huge spike in infections roughly in the run up to Christmas, and then a drop off in confirmed infections, as you can see on the right hand side of this graph, through the Christmas and New Year period. Now that's often a really strange, odd time in terms of testing and, you know, who's in Islington, who's outside of Islington, whether it's elsewhere in the country, visiting family, internationally, whatever. But nonetheless, all the indications were of at the very least a plateauing of infections at a very high level. And now there is some signs of the infections dropping in London, albeit the most recent few days, there are again some signals of a plateauing or perhaps a slight rise in infections. Now, remember, this data that we're looking at here is only about confirmed infections using PCR testing. There's an awful lot of people who don't realise they have the infection, they don't have symptoms, and they may not be testing. There's some people who might get symptoms but not recognise that they could be COVID and don't test. And some people might recognise that they've got symptoms but not want to test because they're worried about the impact on their lives, their livelihoods, and what have you. So this is only a proportion. Also, reinfections, which some estimates suggest could be as high as 50% of cases. Certainly I've heard figures anywhere between 15 and 50% of current infections are reinfections are not included in this data. So this is only a subsample really of all confirmed cases. But as you can see, in the most recent week for which we've had data, and this is really the first week where we weren't including lateral people needing follow-up PCR tests after having a positive lateral flow test, we saw a rate in Islington of about 756 per 100,000 across all ages groups, which is around 1,200 confirmed cases, and around a rate amongst our 60+ population, who obviously amongst our most vulnerable communities, of about 490 per 100,000. That latter figure, even allowing for the lateral flow test change, huge drop happening in that group, and that's really important because they are so vulnerable to becoming seriously ill, getting long COVID, being admitted, or of deaths. Hospitalisations after peaking in north central London, so that's not just about Islington residents, it's also people living in Barnet, Camden, Enfield and Haringey. Hospitalisations in north central London hospitals probably reached a peak about 2 or 3 weeks ago, or at least a current peak around 2 to 3 weeks ago, at about 620 occupied beds with people with COVID. That figure has been drifting down over the last 2 to 3 weeks, and in the most recent data we've got, it's about 460 people currently in hospital with COVID. Now, that's actually been pretty steady for really the last 7 days, so we wait to see where that might go. Now, out of those people in hospital with COVID, actually probably only about 40 to 45% of them are in hospital because of COVID. So in other words, it is COVID that has made them ill enough to be in hospital. About another 55 to 60% of people who are in hospital for another reason, but who have COVID. And when there's such high levels of COVID in the community, and as part of good infection prevention and control measures, hospitals test everyone being admitted in hospital as a way to ensure that people can be kept safe. That doesn't surprise me. But the hospitalisation picture, which could have been a lot worse if infections had increased a lot more, or if this virus had proven to be more resulting in a higher level of serious illness amongst people catching the infection, is probably about in terms of the projections that we were looking at before Christmas about the impact on the NHS, is probably in about the best case scenario. Now, there is no best case scenario other than actually COVID is gone, vaccinations are preventing the infections and people are well. But in terms of the impact on the NHS that COVID could have had, it is amongst the lowest projections that we're looking at. So that's really important. And one of the key things that we are seeing is that people are getting better. There's relatively few people, probably no more than about 30 people at any one time, actually on mechanical ventilation. That's a huge difference from the first and second waves with the previous variant. So that's really very positive. And mortality remains very, very low indeed. So even whilst hospitalisations were peaking at around 620 a couple of 2 to 3 weeks ago, our mortality at the same time, we had no new deaths that week reported due to COVID-19. So the numbers of deaths have remained very low, and that's really because of the vaccinations, the immunity, the nature of this particular virus, and all the things we've done to keep each other safe, to continue to protect the community. Could we go to the next slide, please? And on vaccinations, which is obviously probably the single most effective thing that any of us can do to protect ourselves and to protect others and to protect the NHS and our social care services, is to date just over 419,000 vaccinations have been given in Islington. About 166,000 first vaccinations. That is still going up by anywhere between 1,000 and 500 new first vaccinations every week. And I can tell you, we are absolutely delighted with every new person that comes in for first vaccination. It is the most important thing. And the really important thing is that it has an immediate impact, even within the first couple of weeks, about the risk of becoming seriously ill should you catch the infection. So that's really important. 150,000 second vaccinations, and again that is still going up every week by about another 500 to 1,000 people, and again really overjoyed to be seeing that. And our booster vaccinations, where you can see the chart here which is showing our booster vaccinations, particularly that huge run up ahead of Christmas and New Year. Booster vaccinations, we've now at over 103,000 booster vaccinations happening. Now, the booster vaccinations have now fallen back to the same sort of level before we went into that huge push before Christmas and New Year. And so we're now at about 2,500 people being vaccinated each week. remains really, really important to continue to encourage people to get their booster vaccination, because it does make a real difference. And whilst I was talking about the impact of the infections, about the good news about virus, about the vaccines protecting against acute serious illness, I was hugely pleased to see a very large, important study published at the start of the new year. It was a new year present, I think, for all of us on the 1st of January, when the Lancet published a study looking at the impact of vaccination on long COVID. So particularly when we're thinking about in Islington, what is a reasonably young population, many of whom would perhaps think for themselves personally, they are not at risk of perhaps death or the most serious illness as hospitalisation, albeit certainly hospitalisation does happen in our younger adults. Long COVID is a big impact across people, across all ages, starting from certainly sort of secondary school children all the way up through the age ranges, and can be seriously debilitating in terms of impact on quality of life, your health and well-being. And it can range from perhaps a few weeks of being really still not well to actually, you know, we've got people, you know, 1.5%, 2% of people with long COVID for at least 12 weeks, many of whom may go on to have symptoms for getting on for at least a year, if not longer. And the really good news is that even 2 vaccinations, so this is before the boosters were introduced, 2 vaccinations halved the risk of long COVID. And I think that's a really, really important message, particularly when we consider that we are about to be working with the NHS again about going into schools and offering first and second vaccinations to pupils at a really key time in their educational development, their social development, because protecting against that risk of long COVID is really fundamentally important in terms of sustaining that engagement in education and well-being. And they've been so affected, haven't they, by all of the lockdown restrictions over the last few years. So if you just move to the next slide, Pam, and I promise to jump over these. This just shows you about how Islington compares on first dose vaccination. Remember, we don't really have a very hugely clear view about what our population size is. This uses our largest population estimate to calculate percentage to compare against other boroughs. And you can see Islington is sort of right in the middle or slightly above the middle of inner London authorities in terms of vaccination rates. If we use our lowest population estimate, that figure of 66% in the top left corner goes up to around 79%. We think we're somewhere towards the 79% using other data sources, but those are the ones we use for vaccination. Can you go to the next slide? And this is how we're comparing against on booster doses. So here you see there's a bit more of a mixed picture, with some inner London authorities doing perhaps a little bit better, some outer London authorities perhaps doing a little bit worse. This isn't the proportion of eligible people who've had a booster. This is just simply the proportion of people aged 18 or over who've had a booster. Obviously, to be eligible, you need to have had your second dose at least 8 weeks ago. But this shows you where Islington currently rates in that. And currently we're at 41.5% on this measure. Again, that figure goes up to around 51, 52% if we use our lower population estimate. And in terms of eligible people, we are just over 2/3 of people who are eligible have had their booster dose. Next slide. And this is just a breakdown by age group. Next slide, because I've been talking too much. This is sort of an important look in terms of ethnicity. So when we talk a little bit later on about some of the plans that we're working on and developing about how we reach different communities, age ranges, different ethnic groups, really key in terms of who we want to continue to have those conversations with, continue to encourage. And what you can see is this is across all age ranges, and there remain wide differences between different ethnic communities that come with generally people from Black communities or Black mixed communities having generally lower levels of vaccination compared to generally people from Asian communities and particularly from white communities. But none of this is monolithic. So, for example, when we talk about white communities, one of the things that colleagues in the hospitals are telling me about is that what they are seeing is a relatively high number of people from East European communities currently coming in, often unvaccinated. When we look at Asian communities, if we look at our older age groups, or even people from 40 or 50 over, vaccination rates high. When we look at younger Asian communities, the vaccination rates are generally lower. So there's all kinds of nuances within that, within these mixes. But this is to help us think about where we put some of our efforts to continue to have those conversations about vaccinations. Next slide, please. And this just gives you a ward variation. To be honest, the wards are all very close together. The ones which are sort of at towards the lower end, particularly Bun Hill, Clerkenwell and Holloway, are really because they're quite studenty. And there's a mixture of things about, therefore they're quite young, and you've got sort of lower levels of vaccination generally of age. But also we know from having dealt with outbreaks last term in particular, is there's quite a lot of international students who have been vaccinated, but who aren't, if you like, yet on the UK system. So they're vaccinated, but they're just not counting in the data. Next slide, please. And this is just data showing you for the booster. So what we're seeing on the booster is very high uptake amongst residents by age groups. And in fact, if you were doing it about people who've had their second doses amongst our older age group, is even more strikingly high than is presented here. So that's hugely important, because it's been a huge benefit to our older, more vulnerable community. But you can see, particularly in our younger groups, about just what the fall off is. And the gradient is actually quite a lot steeper than it is for first doses currently, which I have to say from first principles would not surprise me. But again, in terms of getting that booster messages out to people, it's very much younger and middle-aged adults that we think about, whilst obviously recognising that older and clinically vulnerable groups are really important to continue to play if they haven't yet had their vaccinations. Next slide. And this is just a sort of an update by ethnicity, which is a very similar pattern overall to first doses, but again, some of the gradient is actually a bit steeper than we're seeing with first doses at the current time. And then next slide, please. And again, by ward. So there's a bit more of a variation here, but again, if you look at the ones which are towards the bottom, predominantly these are the ones with the same younger studenty populations as well. And then sort of Caledonia and Finsbury Park, where we've identified where we've got particular issues about very high levels of multiple disadvantage within those areas, which also unfortunately link to lower levels of vaccination uptake. And that may be the last slide, Pam. Yes, there we go. I will hand back to you, Navinda and Sue.
Hi, everybody. As I said, I'm always proud to see my ward as the top vaccination. I think it's more to do with the social mix, to be honest, but I do like to think it's probably because I never miss an opportunity to promote vaccinations whenever I can. And, you know, people in the local greengrocers are pretty sick of it now. I think we wanted to go on and talk about what we...
I wondered, Sue, if we could...
Over here.
It's okay.
Yeah.
It's good. I just wondered if we could have some questions for Jonathan, just open it up a little bit, because I'm sure there's quite a few, as well as just thoughts about how we will talk about the action plan in our next bit, but there might be ideas coming from our colleagues on the call about how we can do some more targeting, or how we can get the message across for what are the key messages that we'd like people to receive. And I think some of that information, Jonathan, that you've provided about, you know, that the vaccine prevents hospitalizations and long COVID, you know, those are really key messages to get to people. So hands up or put questions in the chat, and then I'll try and do that. I can see that there's 2 hands up. So Sean and James. So Sean Williams.
Hello, thank you. I'm going to ask a data question, which anyone who knows me, that's not really very much my bag. I tend to do words more than numbers. But Jonathan, on slide 7, I think it might have been slide 9. I'm trying to look at it on my other screen so I can read it. There's a big wodge of people, that wasn't a brilliant word, was it, whose ethnicity is not stated. It's about 40,000 people in there. I just kind of wondered, how is that they don't state it when they go for their vaccination, or how are they not stated?
So there's two aspects from this. So this data comes from general practice system. So it will be whether or not when they registered with the GP, either the GP asked about ethnicity, and there will be some people who, if you like, have been very long-standing patients with practice at a time when practice were not routinely asking about ethnicity, or indeed public services were not routinely asking about ethnicity. The second will be that alongside not having us, that people for whatever reason have not recorded or wanted to offer their ethnicity. As a general measure, a proportion of people without ethnicity stated, because it's GP registrations, may not actually really be registered with that practice anymore, as a general rule. So there are people who may have left the area, had a very fleeting contact with the general practice, etc. That's not from this vaccination data, that's from previous work that we've done with NHS colleagues around that. But it comes from routine data systems, so it is as good as. If I compare it to census data, it is broadly aligned to the census data that we have, which have been updated. So it doesn't suggest that there's a very large disparity between those where ethnicity is not recorded and what we know from other sources about ethnicity within the borough. But it is, as you say, it's a large, I use your technical term, it's a large watch of people.
I think James has his hand up, but also there's a question from Margaret in the chat about Eastern Europeans. So do you want to take James's question first, and then I'll remind you about the Eastern Europeans afterwards, if that's okay?
It wasn't actually, sorry, my name's James. I'm from Soapbox Youth Centre on Old Street. It wasn't so much of a question, it was just to share a piece of work that we've done with the council, instigated by Curtis Ashton, and with an organisation called Break Comms, which was initially an event that was held last year to engage young people from Black and minority ethnic backgrounds in relation to demystifying issues around COVID, particularly around access to vaccines and the booster and things like that. And then a sort of social media campaign that was instigated through Instagram, and then also particularly for us YouTube, which has had 20,000 views of content from predominantly young people. So it was just to say that there are examples of work that's gone on, and I didn't know if people were familiar with that, particularly targeting young people from Black and minority ethnic backgrounds. So just to share that, really.
Thank you, James. I'm sure colleagues from public health will also be interested in that.
I think colleagues from public health were very much involved.
Oh, they were, sorry.
No, it's a council and public health, very much a public health initiative. Yeah.
Okay, so a couple of questions in the chat. So Margaret is asking, Jonathan, can you please tell us more about the reports of Eastern European people being reluctant to get the vaccine? Do we have some specific data? Which countries? Why are they hesitant?
Okay, really good question, Margaret. So I think for the purposes of the kind of data that we have, it doesn't distinguish, it just gets picked up either under a very general heading of East European or just other white groups. It's a bit like some of the Black communities work with, such as the Somali community or some other sort of communities like Turkish, because they can get lost under the ethnic categories which are used. So we're always very alive to looking at other sorts of data. In terms of international sort of comparisons around vaccination uptake levels, a number of East European countries have amongst the lowest levels of vaccinations in Europe and in sort of the I don't really know how you describe it anymore, but if you like, the more developed world. And you can definitely see it in sort of you know, if you think people get a lot of information in sort of mother tongue, you can definitely see that sort of zeitgeist going on. So if you look at the international comparisons of uptakes of vaccination, it's pretty much across the board across most of Eastern Europe that you've got those lower vaccination levels. So for us, it would translate into our largest sort of East European groups, of which the largest would probably even now be people from the Polish community, but there would be many others. And in fact, I was just on a call earlier today with a GP colleague who happens to be Bulgarian, and he's been doing a lot of work with Bulgarian communities across north central London. So it's a general issue about East European communities, I think.
Yeah.
Thank you, Jonathan. And I just wanted to follow up on that about, I had my booster on Sunday and I had to fill the form in terms of ethnicity. They weren't, this was in Haringey, they weren't broad categories of ethnicity. So it was kind of, you know, what you'd see about 10 years ago, even 10 years plus. And so that worried me in Haringey, we're not collecting the data. So you know, my, someone who was standing in front of me who's Bulgarian didn't know which box to tick. So in Islington, do we have broader categories? Is it similarly collecting data through that mechanism? When you go, you register and then you put your ethnicity, or is that just how it's done all across?
Yeah, so I think lots of places use sort of quite broad categories. So they do sort of drill down. So, you know, the reason why I can say Black communities have got lower vaccination levels because it does granulate down to sort of key Black communities. What I couldn't tell you from the data would be Francophone Black communities compared to sort of English speaking necessarily. But you're absolutely right. There'll be certain communities that, if you like, their option is to tick AN other box rather than necessarily what they themselves to identify. Some systems will allow people simply to state their ethnicity. And for example, the other thing, obviously, given the way that we are sort of learning and progressing about views around how people, you know, describe their own gender, increasingly one is moving to systems where people can describe their own gender. So my other job is Director of Sexual Health for London. We run the largest online sexual health service in the world, and actually you can enter the gender that you want to identify with. But as you say, not all systems allow people to self-define all the different aspects of their you know, personality characteristics, etc.
Thank you, Jonathan. So there's a few more questions in the chat. So Mabratu is asking, is it legal to advertise against take-up of the vaccine via distribution of flyers, leaflets, although we know anyone has the right not to take it?
That's an interesting one. So I think if it's about stirring up hate, that's one thing. And I think I'm concerned about some of the imagery that I'm seeing, which is increasingly, to be frank, you can see anti-Semitism coming in. I'm obviously anything which is about targeting children or vulnerable people brings safeguarding issues and aspects. That doesn't necessarily mean it's illegal, but it certainly means that it is a sense about community safety. So for example, when our vaccination colleagues were going into secondary schools in the autumn and winter term, we worked very closely with community safety colleagues and those schools to make sure that there was safety, and that if there were any small anti-vax protests, that there was a very rapid response and schools knew what to do about it. And also, of course, you may have effectively people putting up stickers or leaflets which are effectively on public or other property to which they do not have the right to do that. So you can't stop it as such. It's not against the law as such, but it's certainly, there are aspects to it which would be, if not, if you like, running into legal issues or safeguarding issues, depending on how they're constituted.
Can I pop in with my community safety hat? I think Jonathan's covered all the bases, but the other thing is that obviously intimidating people in any context is almost certainly illegal for a range of reasons. So some of the issues about demonstrations and things like that, you know, where people, you know, not in Islington, thank goodness, have sort of gone off and intimidated staff in vaccination or testing centres, you know, they were clearly not legal. And certainly, I mean, in Islington, I think we would be, you know, very quickly calling the police if that sort of situation ever happened, which I'm very glad to say it hasn't. What we've had, I think, have been a few demonstrations, and as someone who's been on plenty of demonstrations myself, you know, I am absolutely, you know, in favour of the right to protest and against measures that are currently being proposed to stop it. but I think there's limits in terms of the ways in which, the sort of material people might hand out, the places where they do it, and the ways in which they might be intimidating or targeting people with particular vulnerabilities or children. And we have to step in pretty quickly for that, because we have a duty to protect all of those in our community.
Thank you, Sue. So Mabratu is saying that he asked the question because he's picked up several flyers that in the King's Cross area about a campaign against the take-up of the vaccine. But now we know a little bit about what.
Do send me a copy, please, if you can.
Mabratu, could you do that?
Take a photo and send it.
Okay, yeah, I'll do that. I'll send you
Thank you.
Navinda, and then you can share it. Thank you.
Yeah, thank you.
We are monitoring far-right activity in terms of anti-vaccine as well. We know there's a very, very strong crossover between far-right organisations, which obviously mean a lot more harm to us as a borough, and anti-vaxxers. And I mean, not the people who are saying, I'm not sure, I want more information, I'll get around to it, as typically 18-year-olds tell me, but people who are sort of, very actively and rabidly anti-vax. There's a big crossover, and we're monitoring that.
Thank you, Sue.
Gladys.
Gladys,
I would like to ask Jonathan about Black people are not taking a vaccine. And my question is, what is public health and maybe professionals are helping maybe to encourage Black people to take the vaccine more than just like white people and other minorities are taking? What's the thing that they can put in place to help Black people to do that? That's one question.
Thank you, Gladys. So I think some of what James was describing about the work that we've developed about working with young Black people around their views and thoughts and sort of rationale about vaccination. Would they have the vaccination? Why would they have it? Why wouldn't they? That's a really important, I think, long-term way of engaging with actually with any community who are sort of got concerns about sort of important health or other interventions. And that's really designed to sort of stimulate that conversation which is happening within that community and that sort of particular age group, to help people to reach decisions which are right for them. Now, I know what I think the right decision would be about vaccinations. I would happily promote that to others, but I recognise that people need to make their own decisions about doing that. We've also worked through COVID champions, which work across a wide range of different communities within communities to help to really understand, raise awareness, address sort of concerns or questions that people might have, and support people to sort of access vaccinations. We've really looked very differently at the way in which we engage around promotion and communication, looking at the kind of information communication channels that different groups prefer to be able to reach out within communities and to communities around vaccination levels. So that would be just sort of, and we've also done some work around organising pop-up vaccination clinics in settings where particular parts of the Black community are. So, for example, we've had a couple of pop-up clinics at evangelical Black Christian churches, which were very well attended. We've worked closely with some of our friends and colleagues in our mosque to reach out across, not just within or across two Black communities, but generally across the community. So there's been a range of work that we do, Gladys, but that's obviously something that we want to continue to work on.
Yeah, so it's a question about, I think, trust, and I think some Black people are not trust the system that is not in favor of them. And I think I know some people that they are not convinced, and that using us maybe guinea pigs all the time, and they are not gonna have this vaccine. So that's the reason I'm asking that if the professionals need to do more to convince Black people in order for them to take the vaccine, and especially young Black men and women as well.
I'm speaking a language I don't normally speak here, but I would really strongly recommend people go onto Instagram and look at the stuff that has come out of the campaign that James was talking about. That it was a very revealing conversation from a lot of young Black people. And the bottom line is, if you've got a difficult decision to make, you need to turn to people you trust to help you make that decision. And I mean, I think we have all lost a huge amount of trust in our central government over the last period, especially, but also, that young people told us a lot of truths, that they feel that they have not been valued and respected, and that they have, as a result, lost trust in all sorts of, central government, in people who, even in the NHS, because of some of the problems with delivering healthcare in the past from our health services, the ways in which people with sickle cell have been treated, the ways in which pregnant Black women have been treated, for example. And I think what that tells me is that the people in this room are absolutely crucial here, because you are people who people trust. And if you are listening and responding and giving them a bit of not telling them what to do, but giving them information that they ask for and need, then that is how people will make the right decisions, because they'll get that information from somebody they trust. And we do our best to earn the trust of all of our communities, if you like, as local councillors and things like that. But actually, it's the people working on the front line in neighbourhoods, with their communities, with their faiths and so on, who people will actually, want to hear from. So I'm hoping we can maybe, I don't know if there's more questions, but maybe we can move on and think about how that can happen.
Yeah, thank you. Jonathan, I thought you could do the community conversation training, the conversations about COVID-19 and the vaccination as part of the action plan. Did you want to mention a little bit, as we were talking about young people, did you want to mention about the funding for the voluntary sector? And I know Miriam's on the call too. You could do a double act, whoever feels they want to.
So Navinda, Pam, there's another slide set which I promised to go through very briefly, but that gives a little bit of background, and then perhaps we can have a conversation.
Oh, go for it. Okay.
Okay.
Yeah.
And then just picking up on Ali's point about working with people with learning difficulties, we have indeed been working very closely with our learning difficulty services for adults around offering the vaccinations, and that has worked very closely with the services and the surroundings and the settings that they're used to. You're absolutely right. Needle phobia is probably the key reason why people are reluctant to get vaccinations in that group, but we continue to support that very sensitively. So anyway, Community Vaccine Champions Programme. So just before Christmas, we got sort of an early Christmas present, which arrived on the 23rd of December, which was the opportunity to bid for a grant to support community vaccine champion work in Islington. The slight snag was we had to put an initial proposal in on the 28th of December, which I think probably allowed us to have Christmas Day and Boxing Day off, but we had to put it together very, very quickly. But we weren't going to say no. So if you move to the next slide. Thank you, Pam. So it's funding to support a program of community engagement, communication, so not necessarily COVID champions, but all the kind of things that can help to raise awareness, answer the kind of questions or concerns that people have, encourage people to go think about and get the COVID-19 vaccination. Very much working with our colleagues within not just the voluntary and community sector, but also the faith sector, reaching out and working with our colleagues in the refugee and migrant forum sector as well, in terms of linking up with those networks and organisations rooted in the community, working with the community, trusted within the community. And I think, Mabrato, your question about how do we help to convince people about, that it is a safe thing to do to get the vaccines, that it is beneficial to you. I think one of the really key things to actually hear from other people who you know, respect in your community, who think carefully about these things, have thought these things through, and to find out about their experience and to really promote that. Communications engagement work and really link it into local vaccine delivery. Next slide. So we're looking at a mix of approaches around different population groups and geographic areas of focus. So this is sort of roughly where we're at. It's not necessarily exhausted. It might be a little bit more than we're doing, but is this basically where we're seeing the greatest differences in vaccination uptake at the moment? So in terms of that more neighbourhood approach, particularly thinking about the north and northeast of the borough, so starting sort of with Finsbury Park and Holloway and then sort of moving upwards, but then also Bunhill and Caledonian wards in the south of the borough also trending towards lower rates, particularly in our older and more clinically vulnerable groups. Thinking about populations by ethnicity, in general, all of our Black communities across all age groups would be groups that we would want to do more with, reach out and support more. With Asian communities, with that proviso that there is a sort of generational differences between older and younger groups, and then apropos of sort of particularly East European communities, about linking into some of our other white communities, and there'll be some other communities as well at a sort of more granular level. Very keen to engage with parents of children of vaccine eligible age, both for the parents, because as you saw in the age ranges, it's those sort of ages here which are less likely to be vaccinated than others, but also because parental vaccination status is an important factor in whether or not children are vaccinated. And I think that's going to be important, particularly as we're trying to support children in terms of their education and reduce the risk of long COVID. The work that we've already flagged about working with Black residents under the age of 30, we would really like to continue to develop and grow, because it is so fundamental and it's a really long-term conversation. And we also want to make sure that our inclusion health groups are also reached. So whether or not that's street homeless or other people homeless, vulnerable migrant communities, people with alcohol substance misuse workers, issues, sex workers or others, we want to make sure that they too have a good offer of vaccination. Next slide. And the kind of things we're looking at is about working with colleagues in the voluntary community and faith sector to really use their local links, local organisations to reach out into the communities and to really sort of have those conversations, encourage, engage people to think about, raise awareness and hopefully get vaccinations. Developing our current communication engagement offer so it's more bespoke, reaches people through in the right ways, in the right messages, in the right channels. As I say, continued work with our Black residents under 30, targeted work with and for our inclusion health groups, and also to tie that into vaccination delivery. So whether or not it's taking advantage of the fact that we've got many more locations across the borough able to do vaccination, or using the opportunity for local pop-up vaccination clinics, tying that into some more local work either with communities or in particular neighbourhoods. Next slide. Lots and lots of different stakeholders who we're really keen to work with, as you can see here. Next slide. Over to you.
Thank you, Jonathan. Did you want to talk about the funding that's available, or should we pick that up another time?
So I think the overall programme, Navinda, we've got about £480,000 to use sort of between now and the summer. We're working very hard on developing ideas. Obviously, what we'd be delighted to hear would be about people's thoughts about either about particular groups or particular ways to reach people, ideas about how we can sort of do engagement differently. People who are leaders within their own communities would love to hear your ideas about how we could work with you to engage with your communities around vaccination uptake.
Great, thank you. And we can pick some of that intelligence or sharing insight through our health and wellbeing network that's been partly funded to work with organisations across Islington as part of the vaccination take up. So that'll be a good opportunity. And Charlton Brown, who's on this call, he's our local wellbeing networks coordinator, and we'll be doing some of that work. So we'll be reaching out to you as part of that piece of work. So thank you for that. And we wanted to talk about the action plan, unless there's any questions about what Jonathan's just said in those slides. Okay.
Sorry, I've got one, if that's okay, or a couple.
Yeah, of course, go for it.
Just in terms of the timescales and the process for the funding. So do you have an idea as to how quickly any funding opportunity is going to be rolled out, and what will be the process?
So at this point, James, we're still very much sort of forming plans, etc. I think what we're aiming to do is work through sort of networks and fora that exist in order to engage and support the rollout of activities. Don't have a particular timeline, but we're keen, once we've sort of got an agreement about what the overall shape of the plan should be, to do that as soon as we can.
And there's an opportunity for organisations who aren't necessarily part of the networks that you've referred to play a role within that, I guess.
Yeah, I mean, we'd have to think about how it operates in practice, but you know, we're keen through these kind of conversations and other work to sort of reach out and to engage across communities.
Brilliant. Thank you very much. Thank
you, Jonathan. And Chris, over at the Andover Estate Community Centre, is saying that they'd look forward to having vaccinations and info stalls at their food project. And I was going to get onto leaflets, and I will do that in a moment. And Sean, you're asking, I'd also ask if you've seen something great on Facebook or YouTube that you think was effective around engaging. She'd like to see examples. Okay. I don't know if we we could have a summary of what people have thought is useful through when we reach out to you as part of our action plan. Roz, did you want to talk a little bit about what the Faith Forum is going to be doing as part of our work in Bun Hill and the other areas with the lowest take-up?
Sure. We have got 6 large faith groups on board to help us work for the hyperlocal approaches to vaccine take-up. We've said that we would like to tailor the messages ourselves. So we would like to take the key messages from public health and the council, and then it's really for each faith site to decide for themselves how best to reach their community members. I think there are a number of challenges going on at the moment around, we still need to bust some myths, we still need to address some concerns. I think that video of the anaesthetist is still a problem for some of our community members. Well, they still have questions. If a consultant, hospital consultant is saying to the health secretary that he's not going to get jabbed, why should they? And you know, so I going back to Mrabatu's point, I think I'd really like to work on key messages that will address those concerns. But yes, we've got a lot of ideas, but really that the faith groups and particular community groups are able to decide how best to reach their members.
Thank you. I was going to just mention that as part of the work that we're going to be doing with the networks, we've asked, we will have leaflets that contain messaging in the 5 top languages that are spoken other than English in the boroughs. So we're going to have messages in Somali, in Spanish, I've got a list here, Arabic, Turkish and Tigrinya. And those we're working with public health and colleagues on that as we speak. And we will be doing we're going to be disseminating those, distributing those in the 3 key areas of Finsbury Park, Bun Hill and Holloway wards. And we would like offers of help from VCS colleagues to help distribute those leaflets. So if you are interested in helping out, we will also reach out to our mutual aid groups as soon as they're ready for collection, as well as others. So please do feel free to contact myself and Charlton if you would like to be part of the distribution of the leaflets. And then we were thinking about outside tube stations, outside some of the ethnic supermarkets, Poundland and Aldi and other supermarkets such as that, and community centres. So we have Octopus Community Network that will be working with us on a range of things, as well as distribution through the community outreach workers they have and community organisers. So I feel like we've got a bit of a plan of action, but we are putting out a call to, you know, organisations that, you know, can have some leaflets and distribute them from your where you delivering services and other areas. And I can see people have already started saying yes, they can share. So thank you to everybody, but do come forth after this. And we also have some really good material to disseminate to you. So we already have some leaflets in English that you can have. And also Matt was going to come and do some slides about just winter wellness that he'd produced for the excellent Health Watch event that happened a couple of weeks ago. And that gives really good information about the vaccine, including what it's made of and all that kind of stuff. And I was going to ask Jonathan about, there's a lot of vegans who don't want to take the vaccine because they think it's been tested on animals, and we can kind of, you know, that's part of that, you know, myth busting. But there's also some facts that we need to put out there so that people are more knowledgeable about that kind of thing. I don't know if you want to say anything about that now, but and Mabratu, do you want to come in and say what you're going to be also doing as lead for the Refugee and Migrant Forum?
Yeah, I think we already discussed it last Thursday. We're going to have a flyer about, we need a flyer unilateral first in English, and then first before it's translated into different languages. We will engage the members at those areas, the low vaccination take-up areas, and then we will let you know as we go.
And the training, Jonathan, you were talking about in the community conversation. Sorry, I keep saying community conversations. It's because we're here doing community conversations. The conversations about COVID-19. There's some dates coming up that we'd like to for you to put to staff, disseminate to staff, to volunteers. So there's some training next week on the 31st of January. Thank you. So here we go. So we'll send this out tomorrow, actually. So there's some course dates next week and then the week after, couple of hours each. And that'll, Pam, if you just scroll up a little bit, then we could just kind of cover what the course is about. So, well, you can read it there for yourself, but you'll have, I think this is open to everybody, isn't it? Staff and volunteers. It's not specific to staff. I can see Jonathan nodding, so that's all. That's good. And there'll be there'll be other training going forwards, and this is just about helping people have improve their ability to have those conversations about the vaccine and resources and other information. Okay, so I think we've done what I was needing to do in terms of those actual courses. Are there any other kind of final thoughts on this?
Yes. Sorry, I wanted to
yes,
say, I popped it into the chat, but I mean, one of my aims in all of this has been basically to make it really, really easy for people to get vaccinated. So I've put the current information we've got about vaccination centres in the borough into the chat. And so people can scroll back and find it, because everybody got very excited sort of, and put lots of other stuff in the chat too. But my aim, I'm not sure if I got there, was that we should be in a situation where nobody was more than 15 minutes walk away from somewhere they could get vaccinated. And we're kind of almost there. I mean, there are centres all over the borough, and there's quite a lot of availability in some of them, although some others, you know, you'd have to book in advance and things like that. Something that occurred to me is that we did have stewards who were council employees, you know, sort of diverted into doing this work, along with other work, for example, going around shops and encouraging people to sort of, you know, keep the rules about wearing masks and things like that. We needed stewards because we had quite a lot of queues at some of the centres. We no longer need them because the queues are not really there so much. But I wonder if we could not look to see if we can get more volunteers in. My understanding is we've got volunteers already kind of signed up, you know, with Manor Gardens and VAI and Health Watch too, as volunteers. But that, I mean, if people could get the training on how to talk to people, it would be really helpful to have people who are there outside the vaccination centres themselves, the ones that are taking sort of large numbers rather than the chemist on the corner, you know, just to be able to talk to people, encourage them to come in, not necessarily to get vaccinated, but just to see what goes on, actually, because I think people are, you know, worried, you know, they've heard all these sort of funny things, and seeing real people who look like them getting vaccinated and vaccinating people helps. And also that might be there because potentially there's always this problem of anti-vax demonstrations. And when I was at King's Square in December, we had a very small demonstration there. And I think people found it a very reassuring presence to have council stewards, just so that they knew that if they, you know, they didn't have to worry about walking through those people into the centre. So I wonder if we can't look to develop a cohort of volunteers who might be able to stand around outside the centres, encourage people in, you know, answer their questions, not tell them, but answer their questions, and also be there on standby if needed, so that people wouldn't feel intimidated if people come and demonstrate. I am quite worried that this is an increasing sort of wave of activism, really, from people who don't mean any, you know, don't wish us well. And we do need to be careful so that people can get into centres and so on.
Thank you, Sue. Great idea. We will disseminate all the information to the volunteers and get them to help in other ways other than stewarding. Ros, is that an old hand?
No, it's not.
Yeah,
further to the recent discussion, I just wanted to ask if more pop-up clinics are needed, if any more host sites are needed. I wanted to ask whether there are more volunteers needed for the clinics themselves. So are there other, in addition to Sue's point as well, are there volunteers, different types of volunteers needed? And then the last question is around the possibility of a mobile vaccine bus, because I believe the Red Cross has offered something, but whether that would be of interest to Islington.
I was hoping that Russell was still with us, because he's now very ably coordinating all the vaccine sites and where they are and so on. But I appreciate he may, I don't know if he's still there.
Shall I come in on that one, Sue, if Russell's not here? So, good question. Oh, Miriam, did you want to come in?
No, you beat me to it. Go on, carry on.
Sorry. So I think in terms of pop-up tips, because what we're finding is the number of clinical staff who can oversee the vaccination locations is increasingly limited. And there's going to be a big focus on schools over the next several weeks, not just in Islington, but across the whole of North Central London. So I think in the short term, we might find it's a little bit limited in terms of what we can do. We are talking about whether or not potentially, if our schools are able to accommodate it, whether or not we could also take advantage of having, if you like, some pop-up clinics in schools, but we're still working on that with North Central London CCG. So I don't have an answer on that at the moment, Ros. In terms of more volunteers needed, I'm probably not best placed to answer that. Navinda, you might be in a slightly better place, but clearly in terms of that MEC training, so the idea about having good conversation, I mean, one is I would just encourage people, there's a really good training to do, whether you're talking about vaccinations or indeed any other sort of walk of life, but we may well find that that would be a really good thing to do. Mobile vaccine bus, we have looked at it previously, Ross. There are lots and lots of challenges about actually running the buses, and the thing is, logistically, if you've got a community location, it often works better than a bus. And to be honest, one of our really key things is to keep the London Resource Centre on Holloway Road running, and that is taking some of the clinical supervision capacity to do that. So they're all things that we're continuing to think about, Ros, but I don't have any immediate or concrete plans.
I was just going to say about the volunteers. So I think there's lots of opportunities to volunteer at the moment. The clinics, we seem to be not needing as many volunteers right now, and we have a good sign up, but that doesn't mean that in the near future that will be the case. So we will be still putting out a call to arms around that. Councillor Burgess, you have your hand up.
Thanks, Navinda. I was just going to ask if the details of the courses could be put up again and how you register to go on them.
I will send that through tomorrow to all of you on the call.
That's great, yeah. Thank you. Yeah.
Looks like there's quite a few people who are interested in the training, which is good. Yeah, so I'm glad we've included that today. Okay, so we have a minute to go. Final words, anybody? So we're dead on time. How good is that?
I think we should probably just go and do everything we can in that extra minute.
And Janet is waving a hand furiously. Janet, you forgot what you wanted, your last bit. Oh no, maybe she was saying goodbye. Sorry. It looked like she wanted a follow-up question, but she doesn't anyhow. So thank you, everybody. That was such a useful session. I hope it was useful to you, and we will disseminate all the information to you in the coming days. Tomorrow.